surgeries, a long-term follow-up.
Thank you, Chairpersons. The aim of the study was to analyze the ultra-smart foldable intraocular lens for coaxial phacoemulsification surgeries, its optical quality and the long-term follow-up. I'm sorry about the crowding in the slides because I was intimated that only maximum of 6 PowerPoint slides are allowed. In this study, we had taken 30 patients in which we had a cataract of grade 1 to grade 3, and they were implanted bilaterally with this lens with a minimum time interval of 3 months. And you can see the demographic data. And all the patients underwent temporal clear corneal phacoemulsification, and the anterior capsular excess of 5 to 5.5 millimeter was aimed. And after emulsification of the nucleus, the ultra-smart foldable IOL was implanted to a 2.8 mm incision. And post-operatively, the patients were assessed on the first day, after a week, after a month, and after 3 months, and were followed up to 18 months. So coming to the lens, so you can see that this is the design of the ultra-smart lens. It is a thin lens with an optic diameter of 6 millimeters and an overall length of 10.5 to 11 millimeter, but now it's fixed to 11 millimeters. The central thickness is 450 microns and the edge thickness is 150 microns. It's a hydrophilic acrylic with a 26% water content, and the minimum incision size required for implanting this IOL is 1.6 to 1.8 millimeters. And this is not a multifocal IOL. The rings in this lens is to reduce the thickness of the lens from the center to the periphery. And these holes in the haptics aids to the fibrosis formed between the capsule and helps in stabilizing the lens. So following this, coming to the results, now this is following implantation of 30 eyes, that's only unilateral implantation of this lens. You can see that patients acquired a visual acuity of 6.6 to N8 to N6 were 8 patients in the first day, followed by it improved to 12 patients in the first week. And the remaining patients had a visual acuity of 6.6 to 6.9 and N8 to N10. And following bilateral implantation, you can see that 12 patients were able to read N8 to N6 and 6.6, and the remaining 18 patients had a visual acuity of 6.9 to 6.6 and a near visual acuity of N8 to N10. So 12 patients were able to read N8 to N6 unaided post-operatively, and 18 patients required a near vision addition of 1.5 to 2 diopters for continuous reading and for very fine work. Otherwise, they are comfortable for most of the distance without the need of glasses. And you can see the images here, the first day image, 6 months, and after 12 months, and after 18 months. And we study the contrast sensitive Vistec chart, and with this lens, the contrast sensitivity was 10 to 20% compared to the other lenses where it was 40 to 50%. And the accommodation factor in this lens can be accommodated to the forward vaulting of the IOL with the ciliary muscle contraction, the aspherical anterior surface, and the thin optics. And to conclude, the ultra-smart foldable IOL promises to be the IOL of the future with its optical qualities, as also providing a good functional vision without compromising much on the contrast sensitivity. Thank you.
The next paper is from Dr. Nixon from Canada, clinical evaluation of a one-piece hydrophobic acrylic monofocal intraocular lens.
Thank you very much, Chairman, colleagues. I'd like to share with you clinical evaluation and details regarding the Technis one-piece intraocular lens, which has just been released in Europe. The overview of this lens is that it's a second-generation hydrophobic AMO material. It's hydrophobic acrylic. It has a true 360-degree square-edge design. It has a 13-millimeter overall length with a true 6-millimeter optic. It has an offset design of haptic relative to optic, further potentiating the effectiveness of the 360-degree square edge that also exists along the haptic-optic junction. This lens has the patented wavefront optic to reduce spherical aberration, and it has several design features to facilitate implantation, including a thin central optic as well as highly polished haptics. This is the summary of the FDA study, a one-year study, clinical evaluation using the spherical version of this lens. There was 123 subjects in 6 investigational sites, open label, one eye. Gender had a preponderance of females at 56.9%. The mean age of this study was 71.9 years, ranging from 48 to 94. The aim, except for 3 patients, was emmetropia plus or minus a quarter of a diopter. Adverse events, there were 4 subjects that had CME that developed during the course of the study. Only 1 subject maintained that at a year. 1 subject had a lens exchange at the time of surgery secondary to a damaged haptic that occurred regarding improper folding, and 1 subject had underwent a pars plana vitrectomy at 6 months. There was no unanticipated adverse device effects as well as no lens complications. Important results at 12 months. 100% of patients had a best-corrected distance visual acuity of 20/40 or better, with 82.9% having a 20/20 or better, and fully 91.5% had uncorrected visual acuity of 20/40 or better. There were no lens complications reported to date, and very interesting enough, the YAG capsulotomy rate was very low at 2.56%, which may be attributable to a combination of the step vault design along with a continuous 360-degree square edge. If one looks at the right-hand side, there is also evidence doing photo overlays from the time of insertion from 6 months to a year. There is minimal or no movement of the intraocular lens. In conclusion, this lens is safe and effective for intraocular lens implantation. It has the benefits of a one-piece design. It has the excellent track record of the hydrophobic acrylic material, and it has a 360-degree posterior square edge design. And one can see here on the right-hand side a study lens, the first lens implanted by myself in November of 2005.